it should be able to function. So any treatment you provide should be long term so that he can have good future dental health. So that is the long term goal. And the third goal is the professional goal. When you achieve the short term goal, you achieve the long term goal, you will achieve the professional goal. That means the society will have positive attitude towards dentistry. The society, the children, the parents will understand the dentistry is beneficial. So if they come to the dentist, they will go back benefited. So this is the three things you should have in your mind when you treat a child: the short-term goal, the long-term goal, and the professional goal. Now we have what is called the AAPD policy of ethics of failure to treat or refer. Now AAPD is American Academy of Pediatric Dentistry. It is one of the largest and the most effective association for pediatric dentists, and it gives us some rules which we have to follow for pediatric dentistry. What are these principles? These principles, the first principle is children, infants, children, and adolescents, including those with special healthcare needs, that means handicapped children, have a right to dental care. That means treatment cannot be refused. If a child comes to you for treatment, you have to treat the child. You cannot say no. It's their right. Like, for example, it's the right of the child for education. If a child goes to a school, he has to be taught. Nobody can say, no, we'll not treat you. So you cannot say no to treatment by child. Now, again, what is the second rule? The second rule is it is unethical for a dentist to ignore a disease or a condition because of the patient's age, behavior, or disabilities. You cannot say, I will treat only adult patients. No, you cannot say. You have to treat patients of all ages and all behaviors. It may be good behavior, it may not be good behavior. You have to treat the patient. And number three, disabilities. The patient may be handicapped, the patient may have a medical condition. You still have to treat the patient. Now, the third part is, which is the ethical obligation. You should know whether you are able to treat the patient or you have to refer the patient. This is an important skill to have. You should know your capabilities. You should know your competencies. You should know what you are able to treat. Or if it is beyond you, you should know that I have to refer it to a specialist. So these are the three important policies given to us by AAPD. Number one, the right to dental care. Number two, you cannot refuse a patient. And number three, you should know whether to treat or to refer the patient. Now, there are treatment stages. Whenever you get a patient, you have to achieve your goal, you have to use your skills, then only you can achieve the objective. Now, what are the stages of treatment? Number one, as I said earlier, you have to understand the child's psychology. See, there are different types of children. There are different types of children: playing child, smiling child, thinking children. Like I said in my introduction, uh, you have to understand the child's mind before you treat his mouth. Treat the mind before you treat the mouth. You have to go inside the child's mind and understand what he is thinking. It is extremely important to understand child psychology before you start the treatment. Number two, you have to use management techniques. Different techniques, which I will tell you in my second lecture. There are different techniques to manage children. These are scientific techniques, proven techniques, evidence-based techniques, which we use to understand child psychology and use these techniques to make the child cooperative. So you have to do these management techniques. And then number three, you have to treat the child as per the child's requirements. Different children have different requirements. Different children have different dental conditions. Different children have different psychology. So you have to treat the child according to the child's requirements. So whenever you get to treat a child, please do not treat the mouth before the mind. Understand child psychology first, then use management techniques, and then treat the child according to the child's requirement. Now, something about what is psychology. What is psychology? Psychology means how the brain is working. And different parts of the brain are used for different functions. You have something cognitive, memory, learning, development, personality, physiology, perception, language, different parts of the brain are there for different functions. So you, whenever you study the brain, whenever you study, that is called as psychology. Logy means to study. And then we are more interested in child psychology. This is the branch of psychology that studies the social and mental development of children. So you should have some idea about child psychology, which is I'm going to tell you some idea today to uh, to manage a child. So if you don't understand a child psychology, you will never be able to treat a child. And then remember, you will be doing, see, you'll be doing dentistry for the next 50 years at least 50 years. So in 50 years of your dental experience, don't think you don't have to treat children. You will have to treat children, and you cannot refuse these patients. So there is no way you can run away from it. That you are in your clinic and you look from the window and you see in the reception there is child, and you run from the other door. No, it's not possible. You cannot
هنا
avoid
هي.
it. So
لا
it's better
شوفوا
to be
اتوقع ان
positive
لكم مشط
and to
هنا
understand child
قلت
psychology, and
شوف.
you will be able to treat
لا لا
children.
ما هو
And
لك.
at times,
خلاص خذي
children are
مشط من
easier to treat
من
than
الدرج رقم
adults.
3. رقم 3.
Now, there is
اي
something special about pediatric dentistry. Pediatric dentistry means
اي
periodontics. What is special? This is called as pediatric
متأكدة.
dentistry treatment
رقم 2.
triangle. This is something special about pediatric dentistry. In other specialities, the dentist deals directly with the
خلاص
patient.
ما في.
You talk to the
شوفي
patient, you
هنا
ask him
ها.
questions, you take his approval. But in periodontics, it is different. In
سووا وشط
periodontics, there are
برا في
three
مراية هنا كبيرة
people
في
who are
الثلاث.
involved. It is the dentist, it is the
هناك
child
في
patient,
مراية.
and it's the family.
لا
It can
لا
be the
اطلعوا يلا
mother,
عشان ابغى
it can be
اذاكر.
the father. So this is called pediatric dentistry treatment triangle. So dentist talk to the patient, dentist talk to the family, mother or the mother or the father, child talk to the child. So it becomes a triangle. This is the only specialty in which the parents are involved with the patient. And this all happens because all of these child and the family and the dentist come from a society, and they meet in a particular environment, which is the dental clinic. So it
تعب.
becomes, the entire thing is known as pediatric dentistry treatment triangle, which involves the dentist, the child patient, and the father or the mother or the family of the child. And they are in a society and they meet in an environment which is the dental clinic. This is different from other specialities. In other specialities, the dental will interact directly with the patient. But here in periodontics, we have to interact with the parents also. So this is called as pediatric dentistry treatment triangle. So whenever you have to manage the child patient, you also have to manage the mother and the father. So that is what we'll also discuss later. So it becomes at times it's complicated, but at times it's helpful. So you should have this idea that in pediatric
اطلعوا.
dentistry, it will also involve the family, the mother or the father of the child. Now, what
هناك في
happens usually,
مراية
the most
راح
important thing you
اذاكر.
should know about a
هناك في
child
مراية
patient
يلا.
is fear
يلا
and
نشوف كلها.
anxiety. And this I have taught
خذي
you in level 3, but
خذي
I'll just give
اغراضك
you
كلها،
some
وخذي
idea again.
باكلات وخذي كل شيء.
So, what is anxiety? Anxiety is a personal trait and it is apprehension, tension,
لا
or
لا ما هو هذا.
uneasiness that
واحدة
stems from
بس.
the anticipation of danger, the source of which is largely unknown or unrecognized.
طيب يلا
This means
سكر بقى.
the patient scared or in tension about something he has not seen. This is, for example, a patient coming to the dental clinic for the first time, and the patient
طيب
is in the waiting room. The patient is in
طيب
the waiting room, and
طيب.
it doesn't know what's happening inside. So they have anxiety, fear of the unknown. Anxiety is something like you have exams tomorrow. You have anxiety because you do not know
لفة
the
كذا.
questions that are being asked. You have
ايه.
no idea about the questions, so you have anxiety. Then there's fear. What is fear? Fear is the emotional response or consciously recognizing visually external threat or danger. This is when you see something and then you have fear. Then you get scared. For example, a patient can have fear of syringe, fear of lights, fear of white coat, fear of mouth mask. In normal lives, we have fear of snakes. So it can be objective, that is what you see yourself, or subjective, but you hear from others. So you should know whether the child has anxiety or the child has fear. So if you know these things, it will be easier for you to manage the child. Anxiety is fear of the unknown, and fear is when it is direct, when you see something and you have that uneasiness or you have tension or you think that it's going to harm me. For example, some people have fear of the syringe. So this is fear and anxiety. If you have any questions, you can ask me the questions. You can type it here. Now, let us discuss the different types of children which you will meet in the clinics. I want you to, you know what, you should, in your normal life also, you should observe children from now on. And in your mind, decide what type of child this is. Because if you are able to do it now, it will become easier for you in the clinics later. So generally, the child's behavior is of three types: cooperative, lacking cooperative ability, and potentially cooperative. Cooperative means a child is very cooperative. It does whatever you say. Lacking cooperative ability, I'll show you later, means the child is unable to cooperate with you for some reasons. Potentially cooperative means the child comes to you, it's not cooperative, but it has the potential to become cooperative. So let us see some pictures. Here, this is cooperative patient. Most children are cooperative. They are relaxed. They don't have any apprehensions. They have good rapport with the dentist. Means they talk to the dentist very nicely, very casually. They are interested in treatment, and they work within the framework. You tell them, don't move. They don't move. You tell them, open your mouth. They open their mouth, and they don't move. You tell them, when you have to talk to me, lift your hand. They follow your rules. Most of the children are cooperative. Number two, lacking cooperative ability. Now, there are some groups of children, due to young age or due to mental or physical handicap, they cannot cooperate with you. Even if they want to cooperate with you, but they are so young, they are unable to cooperate with you. Or they have some, like for example, this child has Down syndrome, or this child is handicapped. They cannot cooperate with you. Even if they want to, they cannot cooperate. These types of children are called as special children. So first one, cooperative. Second one, lacking cooperative ability. Now there is a third category of children, which are called potentially cooperative children. Now these are children with behavioral problems, but they are able to cooperate. If you use the right techniques, their behavior can be modified and they can cooperate with you. So I'll show you pictures of these both. They are categorized as uncontrolled, defiant, timid, tense, cooperative, and whining. And you must have seen children with your in your homes, with your sisters, children, your brothers, children, your cousins, in your neighborhood. There are so many people, children who are potentially cooperative. You must have seen cooperative children. Because when I ask this in class, most of the students say, no, there are no cooperative children anywhere. No, no, we have cooperative children. And you must also have seen children who have disabilities. Yeah, I'm sure you must have seen those children. And you will also see these children. Let me show you these children, and so that you can recollect, my aunt's younger child is this type, isn't it? Practice so that it will help you later. So now, this is called uncontrolled behavior. Uncontrolled behavior. So what is uncontrolled behavior? This is usually in the age group of 3 to 6 years. Now these children come to the clinic and they throw tantrum. They start crying, they start tears, they start kicking, they start hitting with their legs and arms, they show anxiety, they show fear. So look at this child crying, fighting. So these children are called uncontrolled behavior. Now, if it is in a child who is 3 to 6 years of old age, it is expected. But if it is in a child who's about 13 or 14 years old and they are showing uncontrolled behavior, then there is a deep-rooted psychological problem. So then you have to refer the child to a psychiatrist or a psychologist or somebody who can advise the parents. But you will get children with uncontrolled behavior, fighting, crying. But the good news is, which I'll tell you in my next lecture, if you use the right management techniques, these children become cooperative and very cooperative. So this is uncontrolled behavior. This is my daughter. Next, this is called defiant behavior. Look at the child's face, defiant. Now, this can be more in all age groups. You will see this. And you talk to the child, he looks at you, and you tell him, come here, come to me. He says, no, I don't want to. I don't have to. I won't listen to you. You say, what is your name? He says, I won't tell you my name. And they protest as if they are at their home. They're stubborn. They are spoiled. And they don't respond to what you say. See? Thing like angry child, who refuses to listen to anything. This is called defiant behavior. But they become very cooperative if you win them over, if you use the right management techniques, you manage them properly, they become extremely cooperative. But when they come, they refuse to listen to anything. They say, I don't want to do it. No, I will not tell you my name. These are called defiant. This is called defiant behavior. I'm sure you must have seen children like this. The third one is called timid behavior. Very mild. Look at the face. Very mild. But if you handle them improperly, incorrectly, they become uncontrolled. They start crying. They start fighting. Now these type of children, you know, they hide behind their parents. They hide behind their parents and take their head out and look at you from behind their parents. But if you hold their hands and gently pull them towards you, they will come towards you. But they are hesitant. They show hesitation. They whimper. They produce the sounds of crying. Lift their hands to their eyes, but they don't have tears. And when you talk to them, it looks as if they are not hearing you, as if they don't hear you, or they don't understand what you are telling you. Again, this is called timid behavior, and I am sure you must have seen children like this. Again, these are children, if managed properly, they become cooperative. Then you have tense cooperative. Now, why did I change my voice? Tense cooperative means, when we are having viva with you, oral examination, and we ask you a question, suddenly the voice vanishes and you become very tense. No, you have children like this. This is borderline behavior. They tend to control their emotions. They accept directions, but they are extremely tense. Their speech is tremor, and they start sweating. Hands, hair, brow. They start sweating. It happens to me also. When you have viva, you are tense. This is called tense cooperative. They are cooperative, but they are under a lot of tension. This type of is called tense cooperative. Next one, whining behavior. Now, this type of behavior, look at the face, look at the faces. This type of children, they keep on crying, constantly crying, not loudly, but crying, whining, without tears. Uh, but sometimes they cry with tears, but they don't stop crying, continuously crying, whining, producing crying sounds, and they have this expression on their face. It needs a lot of patience. It needs a lot of patience to manage these children. But if you are able to manage, they will become cooperative. And I know you are sure, there are children, in your homes also, and your parents, the uncles, the aunts say, why are you always crying? What is the matter with you? This is called a whining behavior. Then next, so this is the types of behaviors we have among children. And now, any questions, please? Any questions? Which one you didn't understand anything? Please ask me a question if you want to ask a question. Any questions? Sarah, Rima, Noura, Naif, Ibrahim, Gada, Afra, Abdullah, Tagreed. Any questions, please? Okay. So this is a classification of children according to their behavior. Now there are this classification according to age. You will get children. Just a second. You will get children of different age groups, and every age group is different. So do not expect all children to be show the same behavior. For example, you have a 2-year-old child. He has only motor skills, just with their hands. They like to see and touch. They are very attached to their parents. They have limited vocabulary, and they are interested in self-help skills. They'll hold something and they'll look at it, but they cannot talk to you. You cannot talk to a child who is 2 years old. They will not understand. They are very close to their parents. Then you have a 3-year-old child. Now see the difference between 2 and 3-year-old child. Now 3-year-old child likes to please. They like to be helpful. They have active imagination. They like stories. You cannot tell a story to a 2-year-old child, but you can tell a story to a 3-year-old child. They like stories. They are closely attached to the parents, like they're 2 years old. You cannot separate them from their parents.
ايوه بس هذه
Now,
انا ادخلها في
4-year-old
المين
child
فوق، لا
is
حلو
different.
يجنن.
They enjoy
اي
discussions.
دخليها تحت
They can understand what you say. They
لا
are
والله
big talker
يجنن
and
لا
question. What is this? Why it is here? Why it is white color? Why are you wearing masks? There are so many questions. They have tremendous imagination, but they may become defiant if you handle them improperly. They want details. And they can be reasoned
اسمعي.
with. Means you can tell them, please behave, and if you behave, I'll give you a prize. And they enjoy the 3D aspect of subject. They will look at things from different angles. So see, 2 years is different, 3 years is different, 4 years is different. Now 5 years is different. They will show different behavior. They are stable, they are well adjusted, they like group activities, they are not too demanding, they will not create a lot of trouble for you, but they like their
عسل
things.
عسل.
Whatever they have, they like it.
ابو
So you
بكر
should
لا بس هو
please and
يتكلم
obey,
عن
likes to
ايش؟
please and obey. So you give compliments. Ah,
عن
your dress
الاي
is
ار
so
بيشنت،
nice. Oh, you are
emergency
wearing
patient،
such a beautiful hairpin. So you
طوارئ.
can see these things to a 5-year-old child, but not to a 2-year-old, 3-year-old. They will
يجيك
not understand
قلم
compliments.
يتألم يتألم
But
هذا
5-year-old
الطوارئ.
child will understand. So see the difference in
عرفتي؟
behavior based on
يمسككم
age,
من
and
يده.
then you get the 6-year-old. They are angry, they are tense, they are aggressive, they have difficulties, they don't accept criticism. You tell them something critical or question them, they get angry. They need a lot of praise. Why it is like that? Why are they tense, a peak of tension at 6 years? Because this is the time when they go to schools. And they are coming from the schools, they may have a fight in schools, they are studying in the schools. So they are different. So see, age related, 2 years is different, 3 years is different, 4 years is different, 5 years is different, 6 years is different. You cannot manage a child of 2 years the way you will manage a child of 6 years. Each child, different age group requires a different management technique. So this is age-related psychological traits. Now next, we have something called as Frankel behavior rating scale. We cannot write details in the case history. The child is cooperative, the child is smiling. So we don't do that. We have a scale. This is called Frankel behavior rating scale. We have 4 ratings: rating 1, rating 2, rating 3, rating 4. Now, the first
ماشي.
one is called definitely negative. We write negative, negative 2 times.
اسمعي،
This is a
في
child
كلام
who is
اساسنا قدوه.
uncontrolled, refusal for treatment, forceful crying, fearless,
لا
extreme
والله ما
negativeness.
تحتاجين صراحة.
So you just
خلاص
write on the
تبغين أرواد مرة
in
حلوة
on the file you write 2
في الشنطة
negatives.
اللي تحت.
Rating 2, 1 negative. This
اللي
is
جنب.
like defiant child, reluctance to accept treatment, uncooperative, some negative attitude, sullen, withdrawn. So you'll write 1 negative. Then there is positive, acceptance of treatment, but some hesitation. They follow directions, they agree to what they comply, they want to
اه.
comply. So you say 1 positive. Then there is positive, positive, a smiling child, good rapport, interested in dental procedures, laughter and enjoyment. So you write 2 positive. So it becomes easy for the record to understand the child's behavior. So you write either you write negative, 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 positive, or positive, positive. This is the Frankel behavior rating scale, and it helps you to record the patient's behavior easily without writing the
لما
entire details. You don't have to write these details. If
ما
you
يحتاج
just say Frankel
حرف والله
rating
كذا
scale
نكتب.
negative, people will understand the child's behavior. And somebody can come
اه.
with negative, negative, and by the time
كمان
he goes back,
حطي
it will be positive, positive. So you can see the
المسكرة
change in
ما
the
أدري
behavior,
وينها
and you
الصدق.
can even record this change according to each
شوفي أنا يا
session,
إنها
each appointment.
هي لونها
You can
أسود
record the
حلو،
behavior, and you will see improvement in
فيها
behavior. And
واحد
it should
جهة
not go from
أيلاينر
positive to
وواحد
negative. That
جهة.
means you are doing something wrong. So Frank behavior rating scale helps us in
خلاص.
managing the records. So what affects the child's behavior in the clinic? Why do the children? These are the things
ليه؟
which affect the child's behavior. The child's age, as we talked already, it's
لا
very
لا لا
important.
خليها خليها.
The different children of different age, different
تبغين
they
اكسسوارات
behave
خذي
differently.
كل هذا
Dentist,
خلاص.
I'll discuss in detail in the next time. Maternal anxiety. If the mother is tense, the child is tense. Remember this. So that is why you have to manage the parents also. Past medical history. If they had a bad medical history and they suffered in the hospital or in the dentist, their behavior will be affected. Time and length of appointments. The time, for example, if the child is coming at 2 o'clock and it is time for him to return from school and sleep, and you're trying to treat him, their cooperation will not be good. Or length of the appointment. Please do not make the appointments too long. More than half an hour is not possible for child. Their behavior will change. And patient's awareness of the problems. Patients and the parents be aware of the process. If they think that the treatment is going to be beneficial, they will cooperate with you. If they don't see any benefits, they will not cooperate with you. But two things I'll discuss in detail. One is the dentist, that's you, and the parents. Let us discuss something about this. Now, dentists. See, I have told you this in level 3, if you remember. I want you boys and girls to become smart dentists. Not beautiful, not handsome, smart. See something like this. This is a smart dentist. Clean, neat, smiling, confident, knows how to talk, wears good shoes, clean shoes, eyes are smiling, the expressions are good, the way of talking is good. This is called smart dentist. So I want you to be smart dentist. So what is important? Office appearance and attire. Office appearance. Whenever a child comes to the dental clinic, it should not smell bad. It should not look bad. It should be pleasant, good lights, good smells, and you should have the proper attire. Even for children, we wear funny masks. So it's very, very important to be dressed smartly so that the child likes you. Number two, knowledge of the patient. Right now, imagine when the patients come for treatment, they read everything on the internet. So they have a lot of knowledge. And so you should have knowledge more than them. The dentist should have knowledge more than the patient. So you have to update your knowledge regularly. Don't allow the patient to teach you something. It will affect the patient's behavior. All these things affect the patient's behavior. Dentist speed, skill, and personality. Skill. I have told you this, I think. There are 13 skills which you should have before leave this college. So you should know what you can do, competencies. You should know what you can do independently without supervision. If you cannot do this procedure, you have to refer the patient. So you should know your skills and you should do with speed. It is not very fast, but you should not be very slow also. And your personality, as I described earlier, will affect the patient's behavior. Look at the smart, smiling dentist. Your personality is very, very important. Okay, again, don't use fear-prompting words with children. It will affect their behavior. Don't say blood, injection. No, I'll teach you what we have to talk in the next lecture. Don't use words which the child will get scared. Use of praise, reward versus bribery. Very praise is very important. You have to compliment the child. Oh, you are looking so nice today. Oh, your dress is so good. This helps compliments. But do not bribe the child. Rashwa. Don't say, please take this gift from me and open your mouth. No, then they will expect it every time. You can give them a reward. That means, if you behave properly, I have some gift for you later. It can be a toothbrush, it can be toothpaste, or anything dentistry related. So don't bribe, reward good behavior. And you should have self-control and empathy. Never, ever get angry with a child. Never get angry. Never hit the child. It is not accepted. Because you should have sympathy with the child. The child has pain, the child is swelling, it has not eaten properly, it has not slept properly. Don't expect him to be smiling with you when they come. Then use of command versus suggestions. Command. You go to a child and you say to the child, please, I want to give you injection. Do you agree? No, the child will never agree. The way you have to say it is, I have to give you an injection. So the child, you don't ask yes or no. You suggest, and the child has to say yes. And use words according to age. Use words according to age. Never ever, you cannot, like I told you, you cannot tell a story to a 2-year-old child. You can never tell a story to a 2-year-old child. So talk according to use. And use humor, not big time jokes, but something which makes the child to smile. So always use humor. It will affect the child's behavior. So important things: office appearance, attire, knowledge, dentist skills, speeds, personality. Don't use fear-promoting words. Use praise, but don't bribe the child. Self-control is important. Sympathy is important. Command versus suggestions, you should know the difference and use words according to the age of the patient and use humor. If you have these things, you will be able to manage the child in the clinics. Now we have to talk something finally about the parents. You will get different types of parents. And now in the present circumstances, parents are very knowledgeable. They read everything before they come to the child. So you have to be smarter than the parents. And then you also have to decide whether to have the parents in the clinics or not. So there are different types of parents you will have. And depending on the type of parent, it will affect the behavior of the child. I'll show you a table after this. So what are the types of parents? Dominant, overindulgent, under-affectionate, rejection, authoritarian, over-anxious, over-identification. So let us see what it means and how it affects the behavior. Now, a dominant parent, I know, see, you should think about your parents
كيف
here.
يصير؟
I know sometimes you have the mother or the father, they dominate in the house, they dominate
إنه
everything.
يصير كذا
Nothing can be done without their permission.
خلاص
So, what happens? The
يجي
child
مع
is
البنت
submissive,
التي
means they keep quite shy and anxious.
آه
This is what happens in the clinics also. If the parent is dominant, they try to dominate the
لحظة
clinic,
لما تتجمع
they
الكلمة
try to dominate the
المديتر
doctor.
تكون تفتح
So you should understand, oh, this is a dominant parent.
الصوديوم
So
شانل.
their child, like I said, will be
لما تفتح الصوديوم
submissive, shy,
شانل
and anxious.
يدخل
Now
الصوديوم
there is second type of parent.
الكنال
I
فيسبب
know,
الوجع.
sure, I'm sure you know this type of patient.
آم
It is a parent. It's called overindulgent parent. That means they interfere in everything, everything in the homes. Also, they will decide what you wear, the shoes you buy, the shopping you do, the friends you meet, the relatives you can go. Overindulgent. You get these types of parents in the clinics also. They overindulgent. They spoil the child, and what they do is the child becomes aggressive, demanding, temperamental, because they know there's an old indulgent mother who will interfere in everything, and anything happens bad, and they start shouting. They say, "What happened?" So this is called overindulgent parent. Sometimes we have cases where there is under affectionate parents. You know, they show less love. It usually happens with fathers. People think that fathers don't love their children. It's not true. Fathers love their children maybe more than the mother, but they are not able to show it. So there is less love at times in families. So those children are usually well behaved and shy. Then you have rejection. It doesn't happen. Rejection happens, when there are problems in the family. Maybe the father and the mother are
أبو بكر
divorced, and so the children are
لا
staying with
مرة
somebody else. They
مرة
are
كمان
rejected. So the children become
آه
aggressive, overactive, disobedient, and attention seekers. They create
والله
trouble. They do the same things in the clinic. Why I'm
صراحة
telling you all this is because
جميل.
you will have patients like this. You will have
I
parents
think
like this.
إنه
Then there are
ما في
authoritarian
استفادة
parents.
منه
There's a parent in the home who makes the rules.
غالبا
Rules. Dinner at 8,
لأن
breakfast at 7.
معظم
They
العائلات
make rules.
السودانية والسودانية ما
And then
تستحمل
when they make rules,
الخلاف
everyone is evasive. Evasive means
في
they try
اجتماع
to hide.
في واحد
They don't give correct answers. It happens in the clinics.
ما
The parent
أصلا
is
ما تعرف
authoritarian. You ask the
تسوي
child, do you brush your teeth?
كأنك
The child says yes. No, he's lying. He's saying it because of the parents. So
بعدين
authoritarian parents you will get in the
واو
clinics. Sometimes
خطير
over anxious.
خطير خطير
The child
خطير
just open the mouth, makes a sound. The parents,
يعني
mother says, what
لا
happened?
صدق يعني
Over anxious.
احنا في
Their children are shy,
التنهي
timid, and fearful. Next
انه
one, the last one, over identification.
يعني يتقسم طبعا هذا
You
احسن
know,
لانه
they identify with the
احنا اصلا
child.
ما نشوف
Everything the child they have done,
ما
they want
نشوف
the
ايش
same thing for
يسوي
the child. Over
وهذا يصير
identification.
في
They
البروستات
answer because
ما نشوف
instead of the child. They give suggestions instead of the child. You ask a question to the child and the mother answers. So their
خلاص
children are unsure. They don't
بعدين
answer anything. They have guilt. They are shy because they know that instead of me, my mother or father will answer everything. I don't have to answer anything. So you please look, you have all these types of parents in the clinics because of the pediatric dentistry treatment triangle. You will get all these types of parents. And because of these types of parents, you will have children with such behavior, different types of behavior. So finally, you will have to understand whether to have the child
اوكي
or to have the parent in the clinic or
نعم
not have the
كذا
parent in the
نعم
clinic. It is your decision.
إنه صحيح
So you have to be ready for different types of parents
دقيقة
and different types of children.
كيف أتأكد
Finally,
إنه
you can have an infant, you can have 2-year-old child, smiling child, fighting
دائما
child, happy
ما
child,
في
very defined child, somebody with a medical
شوية
condition, children with
كأنه
trauma. So you'll
سودانية
get different types of children in the clinics, and you will have to be ready to deal with different types of children. So this is lecture number 1, and in lecture number 2, inshallah, in level 9, I will teach you the different types of management techniques. Any questions? You can ask me the questions.